Do you remember waking up in the middle of the night as a child, full of fear after just having a nightmare? What many people do not know is that sleep terrors, or nightmares, are just one form of many types of sleep disorders. Sleep disorders come in many different shapes and sizes, but are generally placed into the following categories: abnormal sleep behavior disorders, circadian rhythm sleep disorders, excessive daytime sleepiness disorders, and insomnia. Abnormal sleep behavior disorders include nightmares, REM behavior disorder, sleep talking, and sleepwalking. REM behavior disorder is when people are physically engaged in their dreams. Sleep talking, it can be in many different forms, including complex dialogues and gibberish. Sleepwalking is more common in children than adults and often occurs when someone is sleep deprived, and it's very important to wake a sleepwalker up so they do not harm themselves or others. Circadian rhythm sleep disorders can be classified in two distinct groups: delayed sleep phase disorder and non-24-hour sleep-wake disorder. Delayed sleep phase disorder is when people are unable to fall asleep and wake at normal times. Non-24 sleep-wake disorder is when your body's internal sleep clock is not on the standard 24-hour clock, and this is very common in blind individuals because of their lack of ability of seeing sunlight. Excessive daytime sleepiness disorders are the most common type of sleep disorders. They are commonly caused by poor sleeping habits and sleep apnea. Extreme sleepiness daytime sleep disorder can be treated by some medications, but most importantly, by getting more sleep and fixing your sleeping habit. Narcolepsy is a disorder that is caused by the brain's inability to normally regulate sleep cycles. The symptoms of narcolepsy are sleep attacks, insomnia, dreamlike hallucinations, sleep paralysis, catalepsy, and sudden loss of muscle tone. Patients with narcolepsy immediately enter the REM cycle of their sleep, not the non-REM cycle. They sleep a normal amount, but they cannot control when they fall asleep. And this is caused by a deficiency of hypocreatine in the brain and can be dangerous and left untreated. Insomnia is difficulty falling asleep or staying asleep, and there are two different types of insomnia: acute insomnia and chronic insomnia. Acute insomnia is brief lapses of insomnia that occur to most people. Examples of acute insomnia are when you cannot sleep before an exam or a big competition or a stressful time in your life. Chronic insomnia occurs 3 or more times per week over the period of 3 months and is most likely needs to be treated.
Okay. The first question is, does everyone who snores or snorts at night have some form of sleep apnea, or could you just snore in general?
Excellent question. Most people who snore don't have sleep apnea, although snoring is the most, of course, 99.9% of people who have sleep apnea snore, but the majority of people who snore do not have sleep apnea. For instance, at around age 60 years old, about 60% of men snore, only around, let's say, 10 to 15% will have sleep apnea. So there's a huge difference between just snoring and sleep apnea.
Taking naps during the day, good or bad for the average person's sleep cycle?
For the average person who does not have insomnia, it can be good to take a power nap in the afternoon. Humans have a biphasic rhythm, like we have a big sleep at night, let's say between 10:30 and 6 in the morning. And then we have a dip in the day around 2, 3 o'clock, 4 o'clock, around that time. It has another dip where we feel tired again. That's why a lot of people feel tired around 2 or 3 o'clock. In fact, in many other countries, they take a siesta or a little nap around 2 to 3 o'clock. Now, a power nap is good as long as it doesn't disturb your nocturnal sleep. So if you're an average person and don't have insomnia, then taking a 15 to 20-minute nap, is okay.
How do natural and artificial lights affect people's sleep patterns?
Natural light or even artificial light in your house, if it's bright enough, turns off melatonin. When it gets dark at night, your melatonin naturally goes on. There's a neurologic from your retina that goes to your hypothalamus and then the pineal gland. So there's a neurologic pathway. And when it gets dark and your eyes perceive darkness and the absence of light, it triggers the pineal to secrete melatonin. Melatonin then goes to the sleep center, and melatonin is not released, and it can inhibit sleep onset, so the person doesn't feel tired. So for people who have trouble falling asleep, we always say, please, after like 7:30, 8 o'clock, keep it dim, and an hour before bedtime, keep it real dark. Read with an indicating look light, and stay away from a lot of all these things, electronics, computers, iPhones, iPads. They put out more blue light, and blue light is a light that really turns off melatonin. So we tell them, please avoid all of computers, iPads, iPods, turn them off. Even TV is not the greatest thing. The best thing is to read with one of those itty bitty book lights, or just it's very dark, just listen to gentle music.
How are over-the-counter sleep products such as NyQuil or over-the-counter melatonin affect sleep and people's natural sleep cycles?
Okay, most of them, like NyQuil, they contain antihistamines, like Benadryl. Most of them have Benadryl, and there are other antihistamines that are very similar to Benadryl. So they can induce sleepiness, and they can help sleep in some patients, and they're not addictive, they're not habit-forming. The only problem is they do often have a long half-life, so the next morning you can feel tired. Also, you can get tolerance to it. In other words, after X amount of days or weeks of taking it, it sometimes doesn't work anymore. So it can be used occasionally if a person, can't fall asleep, he wants to try and fall asleep. Take a little NyQuil now and then. It's okay, but just watch for morning sleepiness. Melatonin can be used if some people who can't fall asleep, they have trouble falling asleep. So we ask them again, keep it dim at night so your natural melatonin is increased. And if you need to, a couple, 2 to 3 hours before bedtime, take like 3 milligrams of melatonin. It can help induce sleep onset. It's not suggested to take the rest of your life or anything like that, but an occasional use of melatonin in certain people, it's good. Now, are disorders where melatonin is the gold standard for insomnia. They're called the circadian rhythm disorders, and like the delayed sleep phase syndrome you may have read about. And these people they have to take melatonin and at night and use bright light therapy in the morning to phase advance themselves or shift themselves to earlier sleep hours. So melatonin is used for circadian rhythm disorders.
Mammals are the only creatures on the planet that will willingly delay sleep. And this is a silly thing, because sleep is a beautiful thing. It is important to get at least 7 hours of sleep at night, or you will not be functioning correctly for the rest of the day. Abuse of caffeine can affect sleep patterns and can cause insomnia. It is important to get the correct amount of sleep per night, and if you're still feeling tired after getting a lot of sleep, it is important to seek out help. Thank you for watching, and I hope you sleep well.